Hi, my name is Dr. Mike Shi. I'm a physiatrist with Kaiser Permanente in Oregon. In this video, I'll talk about how to treat your low back pain or lumbar radicular pain, often referred to as sciatica. First of all, let's go over some red flags. These are signs that something more serious might be happening. Unexplained weight loss, fevers, chills, or night sweats, a history of cancer, weakness in your leg causing you to trip, a loss of feeling in your leg that keeps getting worse, trouble getting your urine to flow when it wasn't a problem before, back pain that began after trauma, such as a fall or a car accident, suddenly having new back pain at age 70 or above, or while taking oral steroids like prednisone or dexamethasone, back pain that wakes you up every night for more than 3 months. If you have any of these red flags, please consult your primary care provider first. As long as you don't have any red flags, here are some important take-home points. Point number 1, there is nothing seriously wrong with your back. It is very, very unlikely that your back pain is due to nerve damage, fracture, cancer, infection, or any other serious disease. Point number 2, most of your back pain is under your control. This includes correct posture, specific exercises, good sleep, a moderate degree of activity, and a confident frame of mind. So if there's nothing seriously wrong with your back, then why do you hurt? The answer is a combination of 2 factors, the spine and the brain. First, let's look at the spine. As we age, the spine ages as well. This happens to everyone, including those without back pain. First, between the bones of the spine, we have these shock absorbers that we call discs, made of a jelly-like substance on the inside and tough fibers all the way around. But because of the long-term effects of gravity, that jelly starts to seep into the fibers as early as our 20s, and the fibers start to bulge. By our late 30s, we lose enough disc jelly that we start to shrink, and by the time we're 70, we've lost about 2 inches in height. As our discs lose that shock-absorbing property, the bones grow broader to absorb more pressure, resulting in bone spurs. This process is called degenerative disc disease, which simply means normal aging of the discs, and usually does not cause significant pain. At the same time, also due to gravity and age, we start to develop arthritis or arthropathy in the facet joints towards the back of the spine, and they grow bone spurs as well. The ligament nearby also grows thicker. These normal age-related changes can narrow the space for the nerves traveling through the spine, which we call spinal stenosis. A mild or even moderate degree of spinal stenosis, or facet joint arthropathy, can cause stiffness, but rarely causes significant pain. How can that be? Well, the answer lies in the brain. While these changes are happening in the spine over time, the brain is constantly processing and adapting to information coming from the body. As long as the conditions are right, our brain can continue to process and adapt, minimizing our pain and maximizing our function. For the brain to do a good job at this, we require good sleep, regular exercise, and a confident, positive frame of mind. As long as we provide our brain with these key conditions, it will automatically know what to do with those signals coming up from our aging spine and minimize any pain. This is why the vast majority of people with degenerative disc disease or facet arthritis experience little, if any, back pain. Now, aside from the normal aging process, there are a couple of things that can happen to the spine that can cause pain. Let's go back to that jelly-filled disc. In Western society, we spend a great deal of time sitting, bending forward, and lifting, but we spend less time walking, bending backwards, or looking up to the sky. As a result, we're often putting unnecessary pressure on the front of the disc, pushing the jelly backwards. After years and years of this imbalance, the jelly can weaken those posterior fibers, allowing some of that jelly to bulge. These disc bulges are not painful. However, continuing that imbalance of pressure may lead to a moment where you do one simple forward bend and some jelly leaks through, which we call a disc herniation. You may experience sudden intense pain, as if out of nowhere. Here's a typical scenario. You bend over just to pick a pencil off the floor, and bam, suddenly you're in the worst pain you've ever had. If that disc jelly irritates the nerve, your pain can be felt in the buttock or leg, often called lumbar radiculopathy or sciatica. Keep in mind that an irritated nerve is usually not damaged, especially if you don't have any weakness or loss of feeling. It's simply telling you that something has intruded into its space. If you have 2 or more of these symptoms, chances are you're dealing with a disc issue. Sudden onset of pain without major trauma. The pain is worse with even the slightest forward bend, like bending over a sink. Coughing or sneezing make the pain a lot worse. Sitting is very painful. If these criteria don't apply to you, skip to the next section of this video. But if it does sound like what you're dealing with, then follow these instructions closely for 1 to 2 weeks. The most important thing is for you to avoid stretching forward for now and avoid pulling your knees toward your chest. Instead, you should do the exact opposite. If you can't do anything else, at least lie face down for a few minutes every hour. The more the better. If it hurts too much, put a small pillow under your belly or prop up under your elbows. The way you know it's helping is that the pain will retreat away from the leg and toward the center of the low back. Or if the pain is already in the center, it will become focused into a small point. This is what we call centralization. If the pain is centralizing, try propping up higher on your elbows or keeping your waist on the ground. Relax your belly and hold for 20 to 30 seconds. Do this several times every couple hours. If the pain starts to peripheralize into the leg, go back to just lying on your stomach for a few days and try again. But if it continues to stay centralized, try a prone press up. Place your hands under your shoulders and push your upper body off the bed while keeping your waist on the ground. Press up as high as you can and lock your elbows. You can adjust your hand position to make it less painful. Breathe out at the top, then lower yourself back down. Breathe in and repeat. If the pain starts to centralize, or as long as it doesn't peripheralize back out into the buttock or leg, go ahead and do 10 of these and keep going higher and higher with each rep. However, if the pain starts to peripheralize, then don't go quite as high. Give it a few days before trying to go higher. When you're done, keep that inward arch in your low back as you get back up onto your feet. For example, you can turn your body and slide off the bed onto your knees while maintaining contact between your waist and the edge of the bed. Then pivot on your knees, turn to one side, get into a lunge position, and rise vertically into a standing position. If you don't have a place to get down on your stomach, try doing 10 standing back extensions, placing your hands in the small of your back. You can even do these with the help of a counter. Again, make sure the pain does not peripheralize. For best results, do 10 prone press-ups or standing back extensions every couple hours throughout the day. Depending on where the disc herniation is, you might find yourself limping or leaning away from the painful side. This is called a side shift, and you'll need to correct that first. If your pain is on the left side, lean your right side against the wall with your feet together and both feet away from the wall. Keep your right shoulder against the wall, bend your elbow 90 degrees, and use your left hand to glide your hips into the wall. If your pain is on the right side, lean your left side against the wall. Keep nudging your hip toward the wall 10 times in a row, getting further into the wall each time. But remember, if the pain starts to peripheralize, back off a little, or bend forward slightly until it stops peripheralizing. After 10 reps, touch your inside foot to the wall, push yourself back onto both feet, keep that hand against your hip, and walk around for a minute. Repeat this exercise every couple hours until you no longer find yourself limping or standing crooked. This approach of centralizing your pain comes from the Mackenzie method. You may wish to get a copy of their book, Treat Your Own Back. In addition to these exercises, there are some very important instructions to follow. If possible, avoid normal sitting. If you have to sit, maintain that inward curve by using a lumbar roll or rolled up bath towel behind the spot that hurts, and lean backward into the seat. A kneeling chair can help a great deal. Take breaks at least every half hour to do a few standing extensions and walk around. Avoid bending forward. When you do have to reach for something, do the hip hinge. Bend your knees slightly, push your butt backwards like you're closing a drawer with your buttocks. This will effectively tilt your body forward enough to place your hand where it needs to be. To pick something light off the floor, you can use the golfer's pickup. by lifting the painful leg behind you so that your body acts like a seesaw. Avoid heavy lifting for now, but if you have to carry something heavy, hold the object against your body around where your belt buckle would be. If walking is painful, try to walk without twisting your pelvis. Once your pain is fully centralized, follow the instructions in the next section to prevent another disc issue from happening. But if your pain hasn't centralized, even after a week of following these instructions closely, contact your doctor or physical therapist. You may need a more specific evaluation. If you just recovered from an episode of severe back pain, or if you get frequent flare-ups of low back pain, then follow these instructions to prevent the next episode from happening. If this doesn't apply to you, then skip to the next section. As a general rule, make sure to do 5 prone press-ups or standing extensions for every half hour of sitting, or for every 15 minutes of stooping forward, such as gardening. The point is to balance out the forces on your lumbar discs. If you don't know how to do a prone press-up or standing extension, please go back to section 1 of this video. Another key principle is to activate your core muscles when bending, lifting, or twisting. Practice this by blowing air out through pursed lips, like pretending to blow up a small balloon. You will feel your stomach muscles activate or brace. You'll also need to use proper body mechanics when lifting. Bend your hips and knees, keep your spine erect, and get your core as close to the object as possible. As you carry the object, keep it fast against your core. You can try bracing your stomach muscles too while lifting by blowing up that balloon. Finally, it helps to have strong core muscles to provide support and bracing for your spine. Do the following exercises every day. The trunk curl up. Lie on your back with one knee bent and the other leg straight, and place your hands behind the small of your back. Lift just your head and shoulder blades off the ground without pushing with your elbows. Hold anywhere between 2 and 5 seconds, then relax back down. Do up to 10 reps. Then rest for a minute, switch legs, and do another set. The side plank. Lie on one side, propping your upper body with one forearm. Place the other hand on your hip. Bend the knee of the bottom leg, but make sure your hip, knee, and shoulder are all in the straight line. Lift your hip off the floor and hold for 10 seconds. Then relax. Repeat 4 times on one side, then switch sides. For more of a challenge, keep both legs straight while doing this exercise. The bird dog. Get on your hands and knees and make sure your neck and back are in a straight line. Activate your core, then slowly raise both your right arm and your left leg to the horizon and slowly bring them back down. Then raise your left arm and your right leg to the horizon and slowly bring them back down. Repeat 10 times on each side, rest a minute, then do another set. If you can't lift your leg at first, just slide it away from your body, straightening it but not lifting. If you're having trouble with balance, you can do this exercise starting with your hands on the edge of a countertop. The bridge. Lie on your back with both knees bent. Push through your heels, lifting your tailbone and your hips off the ground. Slowly lower your hips back down. Do up to 10 reps, rest a minute, then do another set. These exercises are just the beginning of what is known as core lumbar stabilization or core strengthening. For a more complete workout, try Pilates or work one-on-one with a physical therapist. One additional exercise that may help prevent flare-ups is the hamstring stretch. However, do not stretch down to your foot, as this can be more irritating than helpful for some people. Instead, simply do the hip hinge, then shift your weight onto one leg and place the other heel in front of you. For more of a stretch, simply push your buttock further back. Another problem that can happen in our spine, especially if we're obese or have weak core muscles or tight hip flexors, is that we can develop more advanced arthritis in the facet joints as we get older. This can lead to more significant stenosis, where the space gets too narrow for the nerves passing between the facet joints and the discs. In these cases, the pain worsens or peripheralizes into the leg the longer you're on your feet. The pain can be worse when standing up from a seated position. The pain feels better or centralizes toward the spine when leaning over a shopping cart or a walker. The pain is quickly relieved by sitting down. If these criteria don't apply to you, skip to the next section of this video. But if it does sound like you're dealing with facet joint arthritis or spinal stenosis, then follow these instructions. For quick pain relief, lie on the floor with your legs supported by a chair with your hips and knees bent 90 degrees. Relax your back muscles and let your back flatten out. If you can't get down on the floor, lie in bed with your knees propped up on top of pillows. You can also find a chair with armrests and use your hands to push down on the armrests, lifting some of your weight off the seat to relieve pressure off your low back. Once your back pain has calmed down a bit, start doing the following exercises. But if any of them make your pain worse or sends the pain down your leg, stop that exercise and contact your provider or physical therapist. The first exercise is to warm up your facet joints, which is good to do if you've been in the same position for too long. You can do this a few different ways. If you're in bed, pull one knee up to your chest and hold a few seconds, then switch. You can also pull both knees up to your chest, repeat up to 10 times, and then see if it makes it easier to get out of bed. If you're sitting, bend forward and reach down toward your toes for a few seconds. Repeat up to 10 times. This will make it easier to stand back up. The second exercise is called the pelvic tilt. Lie on your back with your knees bent and use your abdominal muscles to push your back flat against the floor. Check with your hand to make sure there's no gap behind your back. Hold for 10 seconds, relax, and repeat 10 times. Practice this every couple hours until it gets very easy to do. Then try doing the same exercise but with your legs flat. Again, push your back flat against the floor to get rid of that gap. Once you've gotten the hang of the pelvic tilt, try the same exercise while standing with your back against the wall. Tilt your pelvis and press your back flat against the wall, getting rid of that gap. Hold for 10 seconds, relax, and repeat 10 times every couple hours. To make it easier, you can start with your feet away from the wall and your knees slightly bent. When the pelvic tilt becomes too easy to do, move your feet backward and straighten your knees out, sliding up along the wall, and try the pelvic tilt again. It may take several weeks of daily practice to get to this level. It's also important to stretch your hip flexors, especially if you do a lot of sitting. While lying on your back, slide sideways to the edge of the bed until one leg is completely hanging off. Then pull the opposite knee toward your chest. You may need someone to help you with this. You should feel a stretch in the front of the hip of the hanging leg. Hold for at least 30 seconds, the longer the better, then switch sides. Stretch your hip flexors at least twice a day. Aside from these exercises, here are some additional tips. To make standing more comfortable, rest one foot on top of a step stool, or if you're at the kitchen sink, the floor inside the cabinet would be a perfect surface. If you're obese, weight loss will decrease the stress on your facet joints. Make sure to get enough aerobic exercise, but choose a form of exercise that keeps your low back flat, such as indoor cycling or portable pedals. Tai Chi can also be a good form of exercise. In terms of diet, a whole food plant-based approach can be very effective, but consult your provider first. So we've covered quite a bit on the spine. What about the brain? Studies have shown that the following things make it harder for you to improve your back pain. First and foremost are incorrect beliefs about your pain. There are 3 main misconceptions that can get in your way. Number 1, physical activity will harm my back. Quite the opposite is true. Movement is essential to keep your core muscles from getting weak and to train your brain to adapt to those changes in your spine. If you're afraid to move, you'll end up doing a lot worse in terms of back pain. Number 2, there is something seriously wrong with my spine. The words we use are powerful in managing our pain experience. Studies have shown that simply getting an MRI of your spine and reading the results can actually increase your pain. To the layperson, technical words like degenerative disc disease or disc bulge create images of injury, undermining your confidence in your own body and your brain's ability to process and adapt to your body's signals. Again, as long as you don't have any of the red flag symptoms, you can be assured that there is no catastrophic problem with your spine. Number 3, my pain is out of my control. Quite the contrary, there are many things you can do to lessen your pain, such as the strategies we've covered in this video. There are a few other things that interfere with your brain's ability to adapt. Narcotics, also known as opioids or opiates. Examples include morphine, oxycodone, Percocet, Norco. These medications sabotage your brain's own pain-relieving mechanisms, such that in the long run, you end up with more pain than if you simply avoided these medications altogether. Sleep difficulties. The brain needs good sleep so it can adapt to new problems, and back pain is no exception. However, certain sleep aids, like benzodiazepines, can alter your sleep architecture and make it harder for your brain to learn and adapt. Emotional trauma. Prior traumatic events can heighten the brain's response to pain. This is because traumatic memories are stored in the amygdala, which then enhances the function of the insula, the same part of the brain that makes you aware of pain. So what can you do to optimize your brain when it comes to back pain? Avoid narcotics and benzodiazepines. Follow good sleep habits. This is called sleep hygiene, and you can find many websites about this online. Address the sources of trauma in your life. One technique is called pain reprocessing therapy. I recommend watching the documentary This Might Hurt for a glimpse into this powerful method. Remind yourself that millions of people have gotten their life back after an episode of back pain, and that means so can you. It's important to let your body move. Aim for 10,000 steps a day. If walking hurts too much, try Tai Chi, or if you need to sit, bicycling counts as steps. You can even get a set of portable pedals and put them in front of your favorite chair. Or try walking up and down the lanes of the swimming pool. There are countless benefits from daily exercise in terms of your heart, lungs, muscles, circulation, mood, endorphins, and especially helping your brain adapt to the changes in your spine. Finally, let's review the 2 main take-home points of this video. Point number 1, there is nothing seriously wrong with your back. As long as you have none of the red flags mentioned in the beginning of this video, it is very, very unlikely that you have any nerve damage, fracture, cancer, infection, or any other serious disease in your spine. Point number 2, most of your back pain is under your control. This includes specific exercises, correct posture, good sleep, a moderate amount of movement, and a healthy attitude. Thank you for your attention, and if you found this video helpful, please share this information with others. Have a great day.